TDAP, or TDAP, stands for thoracodorsal artery perforator flap. This is a highly effective autologous operation that has been used for decades in breast reconstruction. It is an operation that uses the patient's own body tissue taken from the side of the chest. The skin and fat is rotated as a living flap of tissue into the breast area. This operation, once only used for reconstructive problems, is now being offered for autologous, bilateral, simultaneous breast augmentation. The TDAP is a perforator flap, which means that the living skin and fat that is used for breast augmentation is harvested upon the blood vessel that supplies it. The living skin and fat on the lateral chest, underneath the arm and going back towards the spine, is isolated on this blood vessel, and the living tissue is mobilized so that it can be placed underneath the breast for augmentation. The donor area, or the place from which the tissue was harvested, is closed as a straight line horizontally underneath the arm. Unlike other perforator flaps, this tissue remains attached to the blood vessels that supply it. For this reason, it is a much less complicated and less risky microsurgical procedure than other microsurgical procedures which detach the living tissue and reattach the blood vessels under a microscope. Therefore, the flap does not routinely need to be monitored, and the patient does not need to remain in the hospital for an extended period of time. This operation has significant advantages over traditional cosmetic breast augmentation, which is done using implants. When using the patient's own body tissue for breast augmentation, the results are natural and permanent, and there is no need for any foreign material in the body whatsoever.